going to spend the next 20 to 25 minutes talking about how to cope with shortness of breath and chronic obstructive pulmonary disease. And as many of you already know, there are symptoms of COPD that consist of a cough, mucus, shortness of breath with activity, wheezing, and certainly a tight feeling in the chest. But one of the major symptoms of COPD is breathlessness. And often it's a sudden, silent onset. Many people will notice it with fatigue or inactivity and feel that perhaps it's a part of aging or maybe lack of fitness, as a study done with Barnes in 1999. But many of you will understand here that it is a hidden disability. Often your friends, colleagues, neighbors will not understand what your shortness of breath is. They'll often look at you and say, "But you look fine, but you certainly don't feel it." Often individuals will wait. They'll wait. They'll think this breathlessness is just because, I'm aging. But perhaps by the time they actually pay attention to it, they've lost up to 50% of their lung function. This was proven in a study done by Crockett in 2000. Bellamy and Booker in 2000 also talked about how it affects an individual's ability to perform activities of daily living. And certainly this would have a huge impact on needing to be dependent on someone or perhaps issues of social isolation. Small and Lamb in 1999 also looked at COPD and fatigue. And what they were able to see was that there was no influence on age or gender on fatigue, but they did notice that labored breathing affected patients both physically as well as emotionally. In a study done by Neal in 2002, it was a study that was done primarily to assess women, and these women complained not only of breathlessness and fatigue, but also of issues of depression, loss of social support, and stigma related to having COPD. What about the physical, the psychological, and the social consequences of COPD? Well, Heslop in 2001 talked about issues such as coping with activities of daily living, social isolation, depression, and extreme pressure on relationships. So this paints a difficult picture indeed. When you look at a study done by Gift and Macron in 1993, they talked about anxiety and depression, and of note, feelings of hopelessness, worthlessness, and low self-esteem. In a very interesting study done by Margaret Barnett in 2004, she looked at the experience of living with COPD. Margaret Barnett is a nurse working out of the UK in Devon, and I think her study is of personal impact simply because it brings out the personal stories of an individual suffering with COPD. So the next 5 slides I hope to focus on these individual stories. One person said, "I know it's self-inflicted. I'm not very happy about it, but you have to accept it. My mother and father smoked. It was a way of life, smoking. We were not aware then of the health damage it could do. And as many of you can relate, if you smoked way back when, it was the thing to do. It was normal. Everybody did it. So really, in today's world, there's a social stigma around having COPD, and that's often very hard to deal with." Another statement, "Well, every day is different. Some days are worse. A bad day to some is reasonable. A bad day to me is a nightmare." Participants found the morning to be the worst. So this again gives you an idea of the cyclical nature of COPD, the issues of breathlessness that might change from hour to hour, day to day, maybe week to week. What about the effects of inactivity? Any exertion causes breathlessness, which at times can be painful. Bending down in particular can take my breath away. Any sudden movement can do the same. Some days are fine. I can go up and down the stairs fine. Other days I have to stop halfway to get my breath. In dealing with breathlessness, when it's dark, my breathing is worse. The air is so still. I sleep with my window and door open. Sometimes I just toss and turn all night. Sometimes I have to use my blue inhaler, which sorts me out for an hour or so. Breathlessness, again, was the worst symptom for most participants, which again gives you an idea of the so many factors, trying to feel your very best, using your puffers, maybe they work, maybe they don't. What about effects on the environment? Weather seems to affect me. It seems to affect my breathing. Wintertime is bad for me. I always find up September until January to be my worst months. And indeed, in rehab, I see many individuals that will say things like, winter is the worst for me. You've got to help me. Or I'll hear statements like, winter is the worst for me. I'm going to stay in my house and hide. Descriptions of breathlessness. Again, feelings of when panic sets in, when you feel like your air supply is literally being cut off. It's like a garden tube, and if you pinch the tube, it closes off, and you just can't breathe. Breathing can suddenly just go. It feels like you're choking, like something's lodged there. It feels like I'm not going to last very long. I get very frightened. So indeed, this again paints a difficult picture. Support systems, well, often somebody wants to help you, but perhaps you don't want it. So I get very upset when my husband helps me. I realize there's nothing wrong with that. I just find it very hard to accept. What about the emotional aspects of coping with COPD? Well, when you look at research, often the term frustration comes up more than the term depression. Some days I can't do anything and I get very frustrated. I cry a lot. This happens a few times a week. Daily life can be hard and frustrating. Again, the term frustrating. You want to do so many things, but your body is just not able to. There sometimes can be feelings of panic and anxiety related to shortness of breath. During a panic attack, some stated they felt like they were going to collapse, needed to stop and sit down, thought they were going to collapse, again used their blue inhaler, thought it was frightening, felt like they were going to die. You feel as if you're on your last breath. It's very frightening. When this happens, I need someone to hold my hand, to talk to me, to give me comfort, to give me some control. So now we're going to look at this breathlessness cycle to understand why individuals go through this, especially individuals with COPD. And part of it is there's a cycle with shortness of breath, feeling anxious, shallow breathing, increased muscle tension, which makes them feel more short of breath, more tired, therefore they do less, they have less energy, which again increases their anxiety. So it's the spiral that seems to go downwards. And what we're going to do today is talk about how to keep control and how to stay on top of things. What can you do to help your shortness of breath? Well, as Dr. Chapman said, knowing about your medications, taking them as prescribed, using the right inhaler technique, and perhaps having someone assess your inhaler technique. Often I've heard patients make statements like, that puffer isn't doing anything for me, so, I decided to stop it a week or so ago just to see if it would make a difference. And truth be known that if you were to partner with your doctor or perhaps a health professional just to see if you're doing it right, is it benefiting you in the right way, you might get some good benefit from that. The other thing is to stay on top of infections, to have immunizations such as influenza and pneumonia. And, the more you learn, the more you read, the more you find that perhaps I won't take the vaccinations and so forth. And I've heard a lot of that. So really staying on top of it. The other thing you want to consider is staying away from large crowds, staying away from those that are unwell, and probably the most important thing that you can do is, as Dr. Chapman suggested, is having a good self-management plan, knowing what to do when things get bad, speaking with your doctor, partnering with your doctor, and having a plan so that you know when to take action. And often I find that patients wait. Maybe if I wait a day or so, things will get better. Maybe this is just a moment-to-moment thing, and by 2 days, the infection will go. So really, not only having an action plan, but taking action is important. Other tips on managing well? There are some that complain of having clogged airways, so mucus in the airways. So learning how to do controlled cough, it's a technique that's taught, and often what I find is patients will have a mucus plug but might use a very weak cough to bring up the mucus. So really learning how to do a good deep breath with a very strong effective cough, and if the mucus is quite thick, then drinking water helps. Hydrating yourself will help to decrease the thickness of that mucus. Another issue that I've heard come up is the issue around heartburn, gastroesophageal reflux disease. This often happens because there's a backup of bile or acid that goes up the esophagus, and it can aggravate COPD. So speaking with your physician about your symptoms is also an important thing. Breathing techniques are very important.